Hi, my name is Kristen Souza, a licensed mental health counselor specializing in ADHD. And today I'm here to talk to you about ADHD in women. So, men and women can have any or all of the symptoms of ADHD, but current research based on self reports says that women mostly experience more of the inattentive type of ADHD. So, including inattentiveness, disorganization, problems with time management, emotional regulation, issues with dating, shame, and more. So, what is ADHD? We actually did an overview of ADHD in another video that we'll tag in the description below if you'd like to watch that more. But ADHD, or Attention Deficit Hyperactivity Disorder, is a mental health disorder affecting executive functioning. The onset of ADHD is usually in childhood after the age of 5, with symptoms typically persisting into adulthood. Those with adult ADHD can experience an impact of those symptoms in their day-to-day life at work, school, in relationships, etc. For adults struggling with ADHD, this can take a huge toll on your day-to-day functioning and impact your work performance, school performance, and your relationships. ADHD is often misdiagnosed or overlooked in childhood. For adults who have never been diagnosed or accurately diagnosed, it might feel really distressing to consistently struggle with these symptoms. This is especially true for women. Men and women can have any and all of the symptoms of ADHD, like I mentioned. However, let's go over common ADHD symptoms in women. Number 1, inattention. Many studies suggest that women struggle with inattentiveness more often than the hyperactive or impulsive symptoms that men are experiencing. People who are struggling with inattentiveness might feel like they're daydreaming and have difficulty retaining information. So, a good example of this is, let's say you are experiencing inattentive symptoms and you are on a team call and you feel like you are daydreaming and just can't retain the information that the speaker is talking about. Another good example of this is if you are reading a book, you look up and you ask yourself, what did I just read? This is a common thing of inattentiveness in ADHD. So retaining information and being able to pay attention is super difficult. Being overly talkative, we see this one with women a lot. Blurting out a response is also something that we're seeing. This may be a reflection of the mind moving very quickly and impulsively before choosing to speak. Something I see a lot with clients is, let's say you're having a very important conversation with your boss and you interrupt your boss with what you think they're about to say because your mind is moving a lot quicker to the next subject. This happens a lot in women with ADHD. Difficulty listening. ADHD women report difficulty listening. They may find that they struggle in higher education settings and feel they just can't focus or retain the information. They may zone out or feel like they're in a different world. Trouble staying organized. Some women report that they have difficulty managing concrete things like finances or more subjective experiences like work-life balance. When someone's bucket feels like it's overflowing, it can be really distressing, disorienting, and this happens a lot in women who struggle with ADHD. Time management issues. With difficulty focusing comes a sense of time blindness, and this is a big one with ADHD. This means that someone that experiences time blindness might think that they have way more time to finish something, or they have way less time to finish something than they actually think they do. This can cause someone to be late to work a lot, chronically late to things like appointments, dropping kids off at school, things like that, and turning projects in on time, let's say to work, because you think you have a lot more time to complete something than you actually do. Poor emotional regulation. This may be due to shifts in hormones and mood fluctuations. Okay, so poor self-esteem also plays a big role here with regulating emotions, with women getting the sense that they're on display and being judged all the time due to falling short in a lot of areas because of their symptoms that are negatively impacting their day-to-day function and performance. Chronic procrastination can be another concern that women with ADHD experience. Women struggle to manage their time and emotions, as well as staying organized. So a good example of this is, let's say you have your child's schedule for the whole year. You know what you need to do, but you put off a project till the night before to help your kid turn in the next day. Or another good example is, let's say you have a deadline that you've known about for a month at work. You decide to complete that the night before, but it goes over dopamine, and people with ADHD usually have lower levels of dopamine. And when you are waiting to the very last minute to complete something, you are having that instant rush of dopamine and cortisol in your body, which helps you with completing that task. Difficulty dating. So this is a big one because people with ADHD, especially women, experience RSD or rejection sensitive dysphoria because we fall short in a lot of different areas of our life, constantly getting negative feedback from symptoms of ADHD. Therefore, you feel intense feelings of rejection, and we can see that a lot when it comes to dating. RSD is not a diagnosis on its own, but it's a symptom we see people experience that have ADHD. And shame, the cultural expectations prescribed to women can make neurotypical and atypical women feel like they're failing, not meeting standards, or the opposite of perfect. A good example of this is keeping a household organized, staying on top of things, and really comparing yourself to other women in your life. So let's say someone else is super organized, has a really clean house, has projects turned in on time for their kids, and all of those things. It can be really easy to be hard on yourself and feel shame. ADHD in women versus men. So like I said before, women experiencing ADHD often experience inattentive symptoms where men experience the hyperactive and impulsive symptoms of ADHD. While both men and women can experience some or all of the symptoms of ADHD, women experience the disorganization and inattentive symptoms of ADHD. Now, this is really important to note because women are often misdiagnosed or underdiagnosed when it comes to ADHD. In fact, women are often misdiagnosed with depressive disorder rather than ADHD as well. There is a lot of research that supports the idea that there is gender bias involved in the diagnostic criteria for ADHD, with younger boys being labeled hyperactive for big behaviors and ADHD in girls who are assumed to be emotional, shy, or not confident. With children and youth, ADHD is more commonly diagnosed in biological males than females. Gender bias and expectations certainly play a role in the diagnostic process. For example, it's believed in the mental health community that women with ADHD tend to demonstrate more inattentive symptoms rather than the impulse conduct symptoms that males are experiencing, like I mentioned before. Treatment for ADHD in women versus men. For decades, the first line of treatment for ADHD has been medication such as a stimulant. These include stimulants like Ritalin or Adderall. There are also other medications that are non-stimulants or third-line antidepressants. Research supports that women don't display overt symptoms like the hyperactivity and impulsivity, behavioral symptoms that men do. So they don't have as many referrals to get a prescription that men do. Instead, women who internalize may try to overcompensate, want to adopt or meet expectations, and be diagnosed with a mood disorder or personality disorder. Medication is a great option for someone with ADHD in combination with therapy. A lot of people do really well with medication, and a lot of people decide to go the non-medication route and thrive as well. Talk therapy for ADHD is an excellent idea in combination with medication. CBT, cognitive behavioral therapy, and DBT, dialectical behavioral therapy, have been really helpful with people with ADHD. We actually did a video on CBT for ADHD, and we will tag that video in the description for you. How sex affects ADHD treatment. This is really fascinating because our hormones have a lot to do with the medication used for treating ADHD. But first, there are many schools of thought on the use of stimulant medication. During pregnancy, many doctors find it safe, many doctors don't. The research is inconclusive. There's been a lot of studies on it, but they can't say for sure that it's completely safe to take during pregnancy. That's why it's really important to discuss this with your doctor. It's been said that people that took the stimulant before pregnancy are okay to take it during. But again, talk to your doctor about that. There's mixed information out there. There's really no answer about stimulants being safe during pregnancy. Now, just like any other mental health disorders, hormones play a big role in the timing of symptoms and impact of medication. During the 3rd or 4th week of the menstrual cycle, some women experience a decrease in medication effectiveness due to hormone fluctuation. With some women experiencing severe premenstrual symptoms, it's been said that contraceptive use may help regulate or decrease severity of ADHD symptoms in women. So hormones play a big role in the effectiveness of medication, and it's also been said that contraceptive use has also helped with the symptoms of ADHD. Final thoughts on ADHD in women. ADHD can be extremely difficult to deal with and manage symptoms. However, there are effective treatment options out there like medication and therapy. When you see a therapist, it's important to be open and honest about the symptoms you experience so you can have the ultimate ultimate outcome on managing your symptoms. We hope you found this video helpful. We will put in the description any links and videos that we discuss in the video. If you or a loved one are struggling with ADHD, you don't have to do it alone. Talking to a therapist that specializes in ADHD can help you understand your symptoms better. We've linked some valuable resources in the description and comments to help you find a therapist, psychiatrist, and other useful resources. Check them out.